your subspecialty is.
Okay. So hi, my name is Tim.
You can look at me.
Look at you. So that's gonna make me laugh.
No
offense.
I cannot make eye contact if you would like. I can look at the ground and you can just look at me.
I'll get it. I'll be okay. So hi, my name is Tim. That's gonna make me laugh more. So anyway, hi, my name is Tim McCulley. I'm an ophthalmologist. I'm from Maryland, United States. I work at a university called Johns Hopkins University. I actually practice two subspecialties. I practice oculoplastic surgery and I practice neuro-ophthalmology. However, for our trip here in Vietnam, I am teaching oculoplastic surgery.
Are you going to translate?
Yes, I can translate
Later? Okay, sounds good.
Okay.
Yes.
So,
Yeah. So please tell why you are here.
So I'm here with an organization called Orbis, and this is the Flying Eye Hospital, and we travel to different parts of the world to teach various aspects of ophthalmology. There are a number of specialists with us this week. I'm the oculoplastic surgeon.
So can you tell us about your emotion or what impressed you the most? What impressed you the most?
I've done many Orbis missions. I've gone various places in the world. I've gone to India, Nigeria, Ethiopia, and this is the third time I've been to Vietnam. One thing that I've always really liked about Vietnam is the doctors are really good. Some places I go, you have doctors that are knowledgeable, or they have good surgical skills, but maybe they don't have good hearts. All the doctors in Vietnam have been really good. They really care about their patients, and they really want to learn how to to do different techniques to take better care of their patients. And I've always liked the Vietnamese doctors.
So can you tell us more about the support you have given to Vietnamese doctors?
Can you repeat that question?
So can you tell us more about the support you have given to Vietnamese
Support.
doctors?
Okay.
tell us more about the training that you're
Yes.
offering to the local doctors.
Okay. So with these missions, we teach medical and we also teach surgical. We do focus more on surgical. And of the 3 trips I've been to Vietnam, the most common theme has always been teaching doctors how to do surgery to raise eyelids, more often in children, and there are a number of doctors that I've taught how to do surgery to raise eyelids in children that are born with eyelids that droop so much that they can't see. So it helps to make children see better. Another thing we've worked on a lot on this trip is the doctors want to learn more how to do surgery to reposition lower eyelids. So we have a number of positions of patients that as they get older or they've had some sort of trauma or paralysis, their lower lid falls down and no longer touches their eye. So their eyelid is no longer protecting their eye, and we are learning how to do surgery to reattach the eyelid so that the eyelid can protect the eye better.
Can I stop you right here? It's okay. So she's fine. No, she's supposed to sit here.
Your voluntary work. We understand that you come from the voluntary faculty of Orbis, so can you tell us more about that?
More about
voluntary work.
the voluntary work.
Yeah.
So why don't you touch on how important the partnership is with the local hospitals, and so why we're partnering with the local hospitals to deliver the training that they need. So
Yeah, help me out a little
sure.
with
So
that one.
when you're wanting to talk about, it's very important that we partner with the local hospitals to provide the training that they need in certain subspecialty areas. So why don't you talk about, so on Monday, we do training day. So there I help the local doctors diagnose certain type of eye diseases. Then, here we are in the Flying Eye Hospital where we do side-by-side training with the local doctors. I will show them how to do a suture and they'll do it, or, kind of just describe your training a little bit more in depth.
Okay, I think I got something.
Okay.
All right, so a lot of doctors will go on missions to other countries to help take care of patients. There are really a couple models, and I very much like the Orbis model. Many doctors that do this, they'll go to another country and they'll do many surgeries. Maybe they do 100 surgeries and they take care of many patients, but they don't teach much. What's special about Orbis is our goal is to teach the doctors. So maybe we don't do 300 surgeries. We do a lot of surgeries, but maybe not, our focus isn't to do as many as possible. Our focus is to teach the doctors so that they can keep doing surgery after we go. And I think that's much more important. So every time I leave Orbis, every time I leave Vietnam, I feel like we have helped transfer our knowledge to the local doctors. And that's another thing that I've really liked about the Vietnamese doctors. They have a very good foundation and they have a lot of insight into what we can teach them that will help them, which lets us do a better job. So by working with the local doctors, we're able to leave skills behind that they keep doing to help the Vietnamese people. And the way the structures worked is the first day we see the patients in clinic, we talk about diagnosis, we talk about medical management, and we choose patients that would be good for surgery. And then we do surgeries for the rest of the week, 2-3 surgeries a day on average. And each surgery, our goal is to teach the doctor that is with us from Vietnam to do the surgery themselves so that when we are gone, they can keep taking care of patients. And it's not just for 1 week that we take care of patients.
Great. Yep. Thank you so much.
Thank you for having me.
Thank you so much. Thank you.